Okay, thank you. And my next question is, my uncle has an incredible ability to almost sleep on demand. When he shuts his eyes and he wants to sleep, he can get to sleep. And this is despite if he's had a cup of tea, a cup of coffee a few hours before. So caffeine doesn't really seem to have an effect on him. So can you explain why this is?
So what we've talked about is a generalization. Most of the population, this is what the effects of caffeine is on them. But everybody is an individual. Mm-hmm. And you're going to have some people that will swear they have caffeine, but it just doesn't impact on them at all. Okay. Mm-hmm. And so these kind of idiosyncratic effects are there for lots of different drugs. One of the things to bear in mind is there are individuals that metabolize or get rid of the caffeine much faster than others. So some people can drink tea and coffee and their body can get rid of that caffeine quite quickly. Whereas others, it stays in the system for a lot longer. So that could be another reason. And about your uncle, I suppose there is also lots of conditions that or disorders, sleep disorders that need to be investigated. So when you've done all the good things to improve your sleep, if you're still not sleeping well, then it might be useful to actually kind of get consultation with your GP.
Yeah, okay, thank you. So we've talked a lot about how sleep works, circadian rhythms. What is the importance now of sleeping? What are the effects of lack of sleep or, the right amount of sleep?
So there's no single reason why we sleep. It's really, we spend all this time sleeping, but, it's difficult to put your finger on one particular thing. So Fatima, what's the average length of time that recommended for people to sleep, do you think?
I would say maybe 7 hours.
Okay, yeah. So anywhere between 8 or 9 hours.
Okay.
And how many people roughly do you think don't get that 8 or 9 hours of sleep a night?
Don't get a full night's sleep. I bet it's more people than I think. I'm going to say 10 to 15%.
Double that easily.
Wow, okay.
So about a third of adults don't get their recommended sleep. And if you're not sleeping enough, it reduces not just the quality of life that you live, but also your lifespan. People who routinely get less than 6 hours of sleep, a night, there is evidence to suggest they have, first of all, a weaker immune system, so they're more prone to infections. They're more at risk of certain cancers, more risk of particular kinds of dementia like Alzheimer's, and also cardiovascular disease, heart problems. So poor sleep also is likely to result in a range of mental health problems as well. And in my clinical practice, sleep is a really good indicator of people's mental health starting to deteriorate.
So the next thing actually on that I'd like to mention is nowadays there is this idea that sleep is for the weak, and the time that you spend sleeping, you could be working and you could be improving yourself, whether it's business or personal life. And I suppose it's quite a toxic idea to have, to say that you should sleep less and work more. Why do you think that this has come about? And it is such a big thing, with Margaret Thatcher as well, who I think slept 4 hours, and people like to almost brag that they sleep less than other people. Could you talk a little bit about that?
So it's a really good observation, a really, really good observation. And it's something that has happened over the last 50, 100 years in particular. And we live now in an age where it's normal not to get enough sleep, especially in industrialized countries. So America, Europe, South Korea, all of these countries which are heavily industrialized, what we know is that the Center for Disease Control has declared that insufficient sleep is now a public health epidemic. All these industrialized countries, there's evidence of increased mental health problems, weight gain, increased cardiovascular disease, and all the other things that we've mentioned as well. Message I'd like to give across as well is that whereas you've got poor exercise, poor diet, which can take months or years to have its impact on well-being. Sleep, if you're not sleeping well, has its impact within a few days. Really quick impact. And it's worth keeping that in mind.
Mm-hmm. I think another thing that just came into my head is if you think about high-performing athletes and people like that who will take sleep very, very, very seriously because it has incredibly significant impact on their performance. And to say that people who are as high-performing as they are, they take sleep so seriously, then we should do the same as well. Okay, so you've mentioned a lot about problems caused by not having enough sleep. Are there any positive impacts to getting the right amount of sleep?
The first thing that good sleep does is it allows us to make logical decisions and choices, what we might call sound judgments. So often, good sleep helps us make good decisions. Secondly, sleeping has a really important role to play in how the brain lays down memories. So I can remember as well growing up with friends of mine that used to memorize the Quran. And they used to spend time memorizing the Quran before they went to sleep, but also first thing in the morning when they got up as well. Mm-hmm. So it really helps to memorize things and remember things. Sleep plays a crucial role in recalibrating our emotions so that we can meet the psychosocial demands of our day-to-day life, and helps also to balance and cope with traumatic memories.
Yep.
So people, for example, who have had traumatic experiences, they might actually say they've got nightmares, and those nightmares are a way of the brain trying to kind of just grapple with and cope with those traumatic memories. Lastly, there's a fascinating aspect of sleep which we call REM sleep, rapid eye movement sleep. And during this part of sleep, we dream. It's our own internal cinema going on in our minds where you're essentially dreaming. It's almost feels like your own virtual reality. There's still a huge amount to learn about why we dream. And in relation to this, from an Islamic point of view, interpreting dreams is a real specific science. And both the Quran and the Bible has lots of examples of references to dream, a famous one being the story of Joseph, Yusuf alayhi salam.
Yeah. Actually, you mentioned as well, it's almost like a cinema in your brain. Have you seen the movie Inside Out?
Yes.
And they have the production. And I think, did Riley have an embarrassing moment in school or something?
Yes.
They play through what was obviously quite a traumatic moment for her. Mm-hmm. And so that just popped into my mind as you mentioned it.
Yeah, really good example. And Inside Out, I think, we could have a whole session just talking about Inside Out, because it takes what happens in our brains and really brings that to life in terms of sharing our own experiences.
So if there's any listeners who don't know what Inside Out is an animated Disney movie, but it's actually really a very intelligent movie. They had a lot of psychologists and psychiatrists on the set because it's almost trying to give a little bit of life and understanding to what is going on inside someone's head through a Disney movie, which was really, really well done. So back on topic now. How do I know if I am getting enough sleep? Are there any signs that I can look out for?
So the first question I have is, when do you think you didn't get enough sleep? How long ago?
It's straight away, I can say 2 days ago. There was the half marathon on in Leeds, and my little sister was doing that, so I had to get up really early so she could get ready and prepared.
So can I ask, what was really early for you?
It was 7:45.
7:45.
Yes.
So the first question then is, how long did it take you to get out of bed?
Took me from the moment that I was woken up, probably 25 to 30 minutes.
Okay. And is that normal for you?
No. Generally, I can get out of bed once I've woken up.
So, that might be the first indicator you're tired and you wanted more sleep in bed, really.
Yeah, okay.
The second question is, later on in the morning, did you want to have a further nap?
Yes, I absolutely did. I already planned that when I left the house and then I came back, I would go straight to sleep, and I did.
So your body saying you needed more sleep.
Yeah.
And the last one is around when you're awake, did you want to have something like tea or coffee to actually...
Yeah, I was about to buy a coffee when I was out, but I opted for a hot chocolate instead because I knew I was going to sleep when I got back.
And chocolate has?
Chocolate has caffeine in it, as we have learnt today. Yeah,
Can have caffeine. So that was another way of just keeping away. It's got sugar as well, which is going to keep you awake.
Okay, so to finish off our podcast, we have 10 top sleeping tips to help you get a better night's sleep. And so this is basically just a summary of everything that we've said in 10 kind of consolidated points. So we're going to start with our 10th point first of all, Dr. Khan.
First tip is some really practical things.
Yeah.
I've said you spend a third of your life asleep, so really make that sleep as good as it can be. I have a bad back as well, so it's really important to have a really good mattress.
Yeah.
Okay. Really, really, it's worth spending a bit of money investing in a good mattress. Make sure your room is dark. So the blinds that you have or the curtains, are they really blackout blinds? Blackout curtains, and keeping the room at a cool temperature. If warm conditions, hot conditions actually stop us from sleeping.
Yeah.
Okay, so that's the first thing, some really practical things.
I think everyone can definitely relate to being hot when you're in bed, and even when you take the blanket off, and it really, really is not a nice feeling to be too boiling to get to sleep. Okay, so number 9, please.
Gadgets.
Okay.
Of course. So iPhones, stop using them an hour before you go to bed. All right. Ideally, keep them in another room so you're not interrupted by your alarm going off and things like that. The second is watching TV, and not watching TV before you're going to sleep. Okay, the light emitted by your iPhone, TV interferes with your sleep.
And number 8, please.
Eating and drinking. Okay, so first of all, don't have too much fluid late at night because it might push you to getting up in the middle of the night to go to the bathroom.
Yeah.
Okay, and also don't have heavy meals. Okay, again, indigestion interferes with sleep.
Tip number 7.
Have a hot bath.
Okay. Oh, that's you wouldn't think that would help necessarily.
So having a hot bath, it relaxes you.
Yeah.
And hopefully kind of cools you down a little bit as well.
Which is a hot bath. You'd think it would maybe increase your temperature, but actually it decreases it. Tip number 6.
So this is all about medication. Okay. So if you are on medications, don't adjust anything without not talking to your doctor first. But there are medications that people take for their heart, breathing, allergy medications. If you're on some of these medications, speak to your doctor about whether they might interrupt your sleep pattern.
Okay, and number 5?
So number 5 is linked to this, but drinking alcohol, is bad for your sleep pattern. Alcohol, like caffeine, is a substance that interferes with normal sleep architecture. It can rob you of your REM sleep that I mentioned earlier. And heavy alcohol consumption can affect your breathing as well whilst you're sleeping.
Which is interesting, actually, because quite a lot of people will have maybe a cup of some sort of alcohol to relax.
So it does help you relax initially, but if you take it regularly, it actually reduces its impact, and then you need more alcohol from one day to another, and before you know it, your sleep really does go upside down.
Okay, and point number 4.
So number 4 is just get into the habit of having a relaxing routine before going to bed. So look forward to actually going to sleep. Plan your sleep a little bit more. For example, reading, listening to music, hot bath that we've already mentioned. Okay.
And number 3?
So the third thing is around exercise. So on the whole, exercise is really good for you, but there's different forms of exercise. So the message is, before you go to sleep, don't do strenuous exercise. If you're going to do something, some light stretches, okay? But don't go out for a big jog just before you're going to go to sleep.
Okay, and secondly?
Secondly is around caffeine and nicotine, smoking. So we've mentioned a lot about caffeine already, but really try and cut out caffeine after, I would say, 1 o'clock in the afternoon.
Mm-hmm. And our last top tip.
So this is so simple. It is so simple and common sense, but again, not common practice, okay? Develop a really good routine. Wake up and go to sleep at the same time. Your body has this natural rhythm and this internal clock that follows this sleep-wake cycle. When you sleep late one night and wake early the next, it will throw this rhythm off balance. And unfortunately, it's not as simple as being able to catch up on lost sleep from one day to another.
Okay? Yeah, I mean, I'm definitely guilty of thinking, oh, it's okay if I sleep maybe 3 or 4 hours. I can just sleep another few hours a bit later in the day. But it isn't that simple, sadly, as you said.
So rhythm is everything, okay? Regular rhythm.
Mm-hmm. So those are our 10 top tips. I would just like to ask Dr. Khan if you have any final points you'd like to say before we finish.
So sleep is a real blessing from God, okay? It's mentioned a lot in the Quran, and let's not take it for granted. Find out more about it. Like breathing, we have a responsibility to look after our physical and our mental well-being. Mm-hmm. And sleep is a really important way of helping us do that. Do these really simple things that we've mentioned. Yeah. Really simple things like having a routine, not drinking tea and coffee late in the day. Do all these simple things. And if your sleep is still causing you problems, despite using these top 10 tips, then seek medical help and advice, okay? Mm-hmm. Because there are lots of sleep problems that can be investigated.
Mm-hmm. Thank you very much, Dr. Khan, for being on our show today. I hope you've enjoyed being on.
I have loved being on, and thank you for having me again.
No, it's no problem at all. If you would like to learn more about mental well-being, then you can look on our website, because we have a link to the podcast that I recorded with Dr. Khan last week, which was all about breathing. And next week, we will be talking about the powerful impact of thinking. So make sure that you stay tuned. Thank you very much for listening, and we hope you have a lovely day.